Today I am here to explain the topic posterior triangle of neck. Some very important structures are present in this part of the neck, which makes this one of the very important part of the body. So I'll explain the posterior triangle in 5 headings. First, location, then boundaries, then subdivision, contents and clinical aspects. So first we'll see the location. So where is the posterior triangle located? It is located on the lateral side of the neck behind the sternocleidomastoid muscle. Behind the sternocleidomastoid. So now let's see the boundaries. This is the clavicle. This is the mandible. And this is the superior nuchal line. From where the trapezius originates. So let's draw the trapezius. This is the trapezius muscle. This is the sternocleidomastoid. So now let's see the boundaries of the posterior triangle. First, let's go for the anterior boundary. So what is the anterior boundary? Anterior boundary is formed by the posterior border of the sternocleidomastoid. This is the posterior border of the sternocleidomastoid. And the posterior boundary is formed by the anterior border of the trapezius muscle. Next is the superior border, superior boundary. The superior boundary is formed by the meeting point of sternocleidomastoid and trapezius muscle, which meets at the superior nuchal lines of the occipital bone. So the superior boundary or the apex is formed by the meeting point of sternocleidomastoid and trapezius muscle onto the superior nuchal lines on the occipital bone. So next we go for the inferior boundary. This is the inferior boundary of the posterior triangle, which is formed by the middle third of the clavicle. This is the clavicle. The middle third of the clavicle forms the inferior boundary or the apex of the posterior triangle. So once again, the posterior border of the sternocleidomastoid forms the anterior boundary. The anterior border of the trapezius muscle forms the posterior boundary. The superior boundary or the apex is formed by the meeting point of sternocleidomastoid and trapezius muscle onto the superior nuchal line of the occipital bone, and the inferior boundary is formed by the superior aspect of the middle third of the clavicle. The superior aspect of the middle third of the clavicle. Next we'll go for the roof. The roof, from superficial to deep, it is formed by skin, superficial layer. Deep to it is the superficial fascia containing the platysma, and below that is the investing layer of deep cervical fascia, which forms the roof of the posterior triangle. So there are some structures which pierce the roof of the posterior triangle, that is the investing layer of the deep cervical fascia. It is pierced by some structures. Let's see those structures. Yeah. So these are the four cutaneous branches of the cervical plexus. So let's name them. This branch, this is the lesser occipital nerve. Lesser occipital nerve, which is formed from the C2 and C3 spinal nerves. This is the lesser occipital nerve formed from C2 and C3 spinal nerves, and this is the great auricular nerve formed from, the lesser occipital nerve is formed from C2 spinal nerve and great auricular nerve is formed from C2, C3 spinal nerves. This is the transverse cervical nerve, which is formed from same C2, C3 spinal nerves. And this is the supraclavicular nerve formed from C3, C4 spinal nerves. So once again I repeat, the four cutaneous branches of cervical plexus which pierces the roof of the posterior triangle. The first one is the lesser occipital nerve, which is formed from the C2 spinal nerve, and great auricular nerve, which is formed from C2, C3 spinal nerves, transverse cervical nerve, which is formed from C2, C3 spinal nerves, and supraclavicular nerve, which is formed from C3 and C4. Now one more structure pierces, that is the external jugular vein. This is the external jugular vein. The external jugular vein, which begins from the angle of the mandible, it runs downwards, crosses the sternocleidomastoid obliquely, and pierces the roof of the posterior triangle, pierces the investing layer. So these are the structures. These are the four cutaneous branches of the cervical plexus, and this is the external jugular vein. These structures pierces the roof of the posterior triangle. So next is the floor. So I have represented the triangle like this. This is the posterior triangle itself. To mention the floors, I have taken it separately. So basically 5 muscles form the floor of the posterior triangle. The first one is the these four muscles. The semispinalis capitis, splenius capitis, levator scapulae, and scalenus medius forms the four muscles of the floor of the posterior triangle. The posterior triangle is muscular and it is formed by these four muscles. And one more muscle, the first digitation of the serratus anterior also comes under, but then only in some cases. So we are not mentioning it here. So I repeat, semispinalis capitis, splenius capitis, levator scapulae, scalenus medius, and sometimes the first digitation of the serratus anterior also form the muscular floor of the posterior triangle. So another structure, important thing over here is the floor of the posterior triangle is covered by a facial carpet. A facial carpet is covers the muscles of the floor. So the facial carpet is formed by the prevertebral fascia of deep cervical fascia. The prevertebral layer of the deep cervical fascia. It covers the muscular floor. And this facial carpet is important because all the very important structures that we come across later on in the posterior triangle lies deep to the facial carpet. So basically it serves as a protective layer for the very important structures present in the posterior triangle. So facial carpet of posterior triangle serves as a protective layer for the important structures. So these are the boundaries of posterior triangle. Now we'll go for the subdivision of posterior triangle. Can we take it and look at it? Okay. So now we'll go for the subdivision of the posterior triangle. The posterior triangle is subdivided into two parts by the inferior belly of omohyoid. This is the inferior belly of omohyoid. Inferior belly of omohyoid. This muscle divides the triangle into the large upper part and small lower part. The large upper part is called the occipital triangle, named after the occipital artery, which is the content of the occipital triangle, and the small lower part, this is called the subclavian triangle or the supraclavicular triangle. It is named subclavian because of the subclavian vessels which forms the content of this triangle, which we'll see later. And it's also called as the supraclavicular triangle because it is present above the clavicle. So now we'll see the contents of the occipital triangle. This is the occipital triangle. This is the occipital artery. Occipital artery. Over here is the spinal accessory nerve. This is the spinal accessory nerve, which is one of the very important structure of the posterior triangle. This is the spinal accessory nerve. One of the very important structure of the posterior triangle. Below that, two more structures passes. That is the third and fourth cervical nerves. The third and the fourth cervical nerve, which supplies the trapezius muscle as well as the levator scapulae present here. The levator scapulae is present here. The third and fourth cervical nerve supplies the trapezius muscle, and the levator scapulae. And this one, the spinal accessory nerve, supplies the trapezius muscle as well as the sternocleidomastoid muscle, which is very important. It's a 1-mark question. It supplies the trapezius muscle as well as the sternocleidomastoid muscle. And then next is the dorsal scapula. This is the dorsal scapula nerve. Dorsal scapula nerve. Which is also one of the contents of this triangle. So basically, the contents of the occipital triangle are the occipital artery, the 4 cutaneous branches of the cervical plexus, that is the lesser occipital nerve, the greater auricular nerve, the transverse cervical nerve, and the supraclavicular nerve, and the spinal accessory nerve, the 3rd and the 4th, the spinal accessory nerve, the 3rd and the 4th cervical nerves, and the dorsal scapular nerve. Also, there is one more content. This is superficial branch of the transverse cervical artery. Superficial transverse cervical artery. Superficial transverse cervical artery. So all these forms the content of the occipital triangle. Now we will see the contents of the smaller lower part, that is a subclavian triangle or the supraclavicular triangle. So starting with the subclavian vein, which is present at the bottom. Which gives the external jugular vein. The external jugular vein begins at the angle of the mandible. It pierces the, it runs downwards, run obliquely through the sternocleidomastoid, pierces the roof of the posterior triangle, which we have studied before, and it comes downwards and joins the subclavian vein. So the terminal part of the external jugular vein also forms one of the content of the posterior triangle. There is the subclavian vein. This is the subclavian artery, subclavian artery. subclavian triangle. The contents of the subclavian triangle are, firstly, the subclavian vein. Next is the subclavian, the third part of the subclavian artery. The third part of the subclavian artery, and this one which passes transversely to the third part of the subclavian artery is the dorsal scapular artery. Dorsal scapular artery, and this is the terminal part of the external jugular vein. The terminal part of the external jugular vein which ends at the subclavian vein. It also falls under the content, and this is the main content, the upper trunk. This forms the upper trunk of the brachial plexus, upper trunk, middle trunk, and the lower trunk of brachial plexus. This is the suprascapular nerve, and another one, this is the nerve to subclavius. So once again, this is the subclavian vein. This is the third part of the subclavian artery. This is the dorsal scapular artery. This is the terminal part of the external jugular vein. And next is the upper trunk, middle trunk and lower trunk of the brachial plexus. And this is the suprascapular nerve, and another nerve from the upper trunk, nerve to subclavius also comes down. And another content is this one. It is this one, superficial transverse cervical artery or transverse cervical artery. Some lymph nodes are also present here. These are the supraclavicular lymph nodes. Supraclavicular lymph nodes are also present. So once again, I'll explain the contents briefly. In the occipital triangle, occipital artery, the four cutaneous branches of the cervical plexus, the spinal accessory nerve which supplies the trapezius muscle, the sternocleidomastoid muscle, and the third and the fourth cervical nerves which supplies the trapezius muscle, and the levator scapulae, and the dorsal scapular nerve, and the superficial branch of the transverse cervical artery. These form the contents of the occipital triangle and the subclavian triangle. Starting from bottom, this is the subclavian vein, the third part of the subclavian artery, a dorsal scapular artery transverses it, and then the terminal part of the external jugular vein which ends at the subclavian vein, and then three trunks of the brachial plexus, upper trunk, middle trunk and lower trunk. Upper trunk here it gets divided into suprascapular nerve. Then here it is the nerve to subclavius which goes down, and over here it is the superficial transverse cervical artery, and some lymph nodes are present called the supraclavicular lymph nodes. So next we will go to the clinical aspects of the posterior triangle. One of the clinical aspects of the posterior triangle is, okay, first we will go for the important contents present in the posterior triangle. The main important content of the posterior triangle are, the contents of the posterior triangle are the third part of the subclavian artery, the brachial plexus, the three trunks of the brachial plexus, the spinal accessory nerve and the lymph nodes. So All these important structures except the spinal accessory nerve is present deep to the facial carpet of the posterior triangle. The facial carpet which we have studied, it is formed by the prevertebral layer of the deep cervical fascia. So all these important structures which I have mentioned is present deep to the facial carpet except the spinal accessory nerve. So during surgeries like removal of the lymph nodes, due to inflammation of the lymph nodes, for removal of lymph nodes or for biopsy of lymph nodes, surgeries are performed in this area. So because the spinal accessory nerve is superficial, it is this. Oh, one second. So next we'll go for the clinical aspects of the posterior triangle. So the most important structures present in the posterior triangle are the third part of the subclavian artery, the brachial plexus, the spinal accessory nerve, and the lymph nodes. So all these important structures except the spinal accessory nerve is present deep to the facial carpet. We have studied the facial carpet, right? The facial carpet is the which it serves as a protective layer formed by the prevertebral layer of the deep cervical fascia. So all these important structures are present deep to the facial carpet except the spinal accessory nerve. The spinal accessory nerve is present just underneath the roof, that is the deep investing layer of the deep cervical fascia. It is not present under the facial carpet, it is superficial. So during surgeries, that is removal or for taking biopsy of the lymph nodes, the spinal accessory nerve may get damaged during the surgeries. So that is one of the clinical aspects regarding the spinal accessory nerve. When the spinal accessory nerve gets damaged, it causes paralysis of the trapezius muscle, because the spinal accessory nerve supplies the trapezius muscle, which causes difficulty in combing of hair. So damage of spinal accessory nerve causes the paralysis of trapezius muscle, which causes difficulty in combing of hair. So that is one of the clinical aspects. So a question will arise: why is the sternocleidomastoid not paralyzed? Because the spinal accessory nerve supplies both trapezius and sternocleidomastoid, but during the spinal accessory nerve damage here, why not the sternocleidomastoid is not getting paralyzed? The answer for this question is the spinal accessory nerve enters the occipital triangle by supplying the sternocleidomastoid. It emerges the posterior triangle by supplying the sternocleidomastoid. So it is already supplied, and then it goes in and supplies the trapezius muscle. So therefore, any damage over here causes the paralysis of trapezius muscle and not the sternocleidomastoid, which is one of the questions asked for clinical aspects. And the next clinical aspect is the nerve point of the neck. This is the nerve point of the neck, which is right at the junction between the upper and middle third of the posterior border of the sternocleidomastoid. This is the nerve point of the neck, where the four cutaneous branches of the cervical plexus and the spinal accessory nerve joins. This point is the nerve point of the neck, where for performing surgeries where the cervical plexus blockage is necessary, the anesthetic agent is injected at this area, that is the nerve point of the neck for cervical plexus nerve block. And that is one of the clinical aspects. And the third clinical aspect is the brachial plexus block. So for performing surgeries in the upper limb, the brachial plexus should be blocked. The brachial plexus this plexus should be blocked. So anesthetic agent is injected at this area for blocking the brachial plexus for surgeries in the upper limb. And then the fourth clinical aspect can be pulsation of the subclavian artery, which is present at the root of the neck. So pulsation of the subclavian artery can be felt at the root of the neck. Yeah, and then the next important clinical aspect is enlargement of the posterior triangle. Yeah, no, swelling of the posterior triangle. Swelling of posterior triangle is caused mainly because of the enlargement of lymph nodes present on the posterior triangle, mainly due to the supraclavicular lymph nodes. When these lymph nodes get enlarged, it causes swelling of the posterior triangle. Yeah, these are the clinical aspect, and this is the topic. Hope all of you understood. Thank you.
Thanks.